Good morning. Today we're going to discuss about the beneficial effects of exercise in protecting the cardiovascular system. This is the video number 7 of the Exercise is Medicine series. So, do you think that endurance exercise has any effect in your cardiometabolic health? What is your opinion? Well, there are a lot of data, randomized clinical trials showing that it has an effect, and it is a powerful effect, sometimes more powerful than many drugs that are available on the market. This is just a summary of what we know on the effects of regular aerobic exercise training when combined with weight loss. I'm going to show you that without weight loss, the beneficial effects of exercise are very, very low, unless you're already lean, and then the exercise is powerful to keep your cardiometabolic profile super healthy. But if you are obese and overweight and you are not losing weight with exercise, the beneficial improvements are very, very small. Now, what we know is that endurance exercise, when combined with weight loss, definitely, without any doubt, improves insulin sensitivity markedly. I already talked about it in the previous video, in a couple of previous videos. Then, of course, it reduces insulin, improves glucose tolerance, or it reduces glucose and the risk of diabetes. Multiple studies have shown that when exercise is combined with weight loss, results in a reduction in serum triglycerides, and lots of data, good data, showing an increase in HDL cholesterol and a reduction in LDL cholesterol. The data on the effects of lowering blood pressure are really mostly based on epidemiological studies. Definitely exercise as an acute effect in lowering blood pressure, but in medium long-term randomized clinical trial, the effects of exercise in lowering especially systolic blood pressure is very, very low. And then there is some effect in lowering inflammation, but it's not as powerful as we will see in this video as calorie restriction. Now, this is the summary. I know that many of you are very busy, so if you want to listen more, now I'm going to discuss in detail some of the important studies that I've selected among many. These are randomized clinical trial. I'm not going to talk about epidemiological association studies. And let's start with the first one. This is on obese individuals, people with a BMI higher than 30, randomized to 4 interventions: control, weight loss induced by calorie restriction, weight loss induced by exercise, or exercise without weight loss. This paper has been published in Annals of Internal Medicine in 2000 by Ross et al. So if we compare the diet-induced weight loss with exercise-induced weight loss group over 3 months, both achieved around 7.4, 7.6 kilos of weight loss, with a similar reduction in waist circumference, total fat reduction, similar 5 versus 6 kilos weight loss, visceral fat, 1 kilos approximately of reduction of visceral fat, abdominal fat similar. Of course, there is some sparing effect on exercise in terms of skeletal muscle, minus 1.3 versus minus 1.7 kilos of skeletal muscle weight loss. So out of these 7.4 kilos of weight loss, 1.7 is skeletal muscle, and here it's 1.3 only. Now, as you can see here, there is a similar improvement in similar reduction in fasting glucose, in fasting, but fasting insulin, you see it's much higher. As I show you, as I discussed before in the previous video, exercise is the gold standard intervention to improve insulin sensitivity. So you can see a similar body weight loss, similar abdominal fat loss, similar visceral fat loss, but exercise, the reduction in fasting insulin, it's 29 picomolar per liter versus 10.5. Glucose area under the curve in response to a glucose load, similar reduction, 2.9, 3.4. However, again, insulin area under the curve after an OGTT is much higher, 898, almost 900 versus 393, double, okay? More than double. And there is an improvement, much higher improvement in glucose disposal. And as you can see here, the exercise is in significant increase in VO2 max, maximum oxygen uptake, 0.5 liter per minute in only 3 months of exercise. Of in the weight loss, there is a reduction in maximum oxygen uptake. Now, as I said, an important message of this paper is that only if you have weight loss, both in diet weight loss, exercise weight loss compared to controls, no change. This is visceral fat, and this is subacute, whole body subacute body fat. As you can see here, the reduction, there is a major reduction in subacute and visceral fat in both the diet and exercise weight loss, but is the change in exercise without weight loss is very, very low and non-significant, okay? So you need to lose weight to have an improvement in some of these cardiometabolic parameters, because as you can see here, there was an increase in VO2 max, because the exercise-induced weight loss group and the exercise without weight loss group, the VO2 max went from 3.8 to 4.3, and here from 3.7 at baseline to 4.4. So both had an equal increase in VO2 max. However, there is no improvement in fasting glucose, insulin, area under the curve for glucose and insulin, or systolic, diastolic blood pressure. In contrast, there's been an improvement in OGTT, insulin, and the trend for improvement in systolic, diastolic blood pressure with the weight loss induced by exercise. So take home message: exercise is powerful even in obese individuals, super insulin sensitivity, glucose and blood pressure. However, you need to lose weight. Similarly, this is a study we conducted at Washington University with John Hollows and other colleagues. We took, these are not obese individuals, these are overweight, BMI 25 to 30, age 50 to 60, randomized to control, calorie restriction 20% without exercise, or exercise without calorie restriction, 20% of increase in energy expenditure over 1 year. We were able to achieve, as I discussed in a previous video, 8% weight loss, both with exercise and calorie restriction. To achieve these terrific weight loss with exercise. These people, based on the accelerometer data, were exercising 1 hour a day, 6 days a week at 70%, 72% of maximal heart rate. Okay. Now, as I said, we got a 30% reduction in body fat measured by DEXA with both interventions. We got a 40%, approximately 39%, 37, 39% reduction in visceral fat by MRI. In a previous video, I erroneously said, that exercise results in a 74% reduction in visceral fat. That was just in a few individuals that they were the superachiever of the study. On average, we got a 39% visceral fat reduction. That is huge. However, only in the superachiever, in those who really exercised constantly and regularly at high levels, we had a 74% reduction in visceral fat. Now, this reduction in subacute and visceral fat resulted in a 30+% reduction in leptin and a 30% increase, 20 to 30% increase in adiponectin, that is a powerful insulin sensitizer hormone. And these are the results of a paper we published in American Journal of Physiology. And as you can see here, both exercise and CR had a significant, big reduction in LDL cholesterol. So exercise by itself is able to reduce your LDL cholesterol. In this study, we achieved over a year a reduction of 17 milligram deciliter of LDL cholesterol, and with the CR19, but with the exercise, we had a major, basically almost significant 0.06 increase in HDL cholesterol, the good cholesterol, so the ratio is fantastic. And we also had a significant, almost significant increase of HDL cholesterol with CR, but less than with exercise. So exercise in general is more powerful than diet in increasing HDL cholesterol. We had a significant improvement in HOMA, insulin resistance index, but diet is more powerful in lowering inflammation. This is a significant reduction in C-reactive protein, 0.7 milligram deciliter, that we don't see in the exercise. There is a trend, but it's not as powerful as diet in lowering inflammation. Now, in another study of some colleagues at Washington University, Ted Weiss and Dennis Villarreal, that we have been working with for many years, they did another study. This study was done comparing, again, in overweight, middle-aged individuals, men and women, CR, calorie restriction versus exercise, or a combination of CR and exercise. And they've been studied when these people, they achieve between 6 and 8% of weight loss. Again, the average age is 57 years old, and the average BMI at baseline was around 27, 28 of BMI. Now, as you can see here, both CR and exercise had a significant reduction in body weight. It was basically minus 5.4 kilos, minus 5.6, minus 6. So similar reduction in body weight. Waist circumference, basically exercise was more powerful, 9.8 compared to 7, 6.5. Even if it was not different between groups, but there was a higher reduction in waist circumference. Total fat by DEXA, again, similar across groups. but lean mass, that's important, was preserved, was spared by exercise. In this study of the 5.6 kilo of weight loss, only 0.2 kilos were due to lean mass, instead of 1.1 kilos of the 5.4 kilos of weight loss in the CR were due to lean mass. And in terms of trunk fat by DEXA, so abdominal fat by DEXA, similar results, approximately less, minus 2.53 kilograms of weight of trunk fat loss. In terms of systolic blood pressure, as you can see here, and we knew that, this is confirming in a randomized clinical trial, diet, calorie restriction is much more powerful than exercise in lowering systolic blood pressure. That is an important risk factor for heart disease and stroke. And from 121 to 111, instead of no change in the exercise, there was a significant reduction in the combination of exercise and calorie restriction. Diastolic, we had a significant reduction that was higher in the combination of exercise and CR, and similar in exercise and CR. In terms of total cholesterol, similar reduction, 15, 14. So again, confirming that exercise by itself can lower total cholesterol. And LDL cholesterol, minus 10 of these 15 was the bad cholesterol, LDL cholesterol, here minus 14 and 12 in the calorie restriction. Sorry, this is the calorie restriction, minus 15, minus 10, and this exercise, minus 17, minus 7. And the combination of exercise and calorie restriction is more powerful. Minus 22 of total cholesterol, milligram deciliter, minus 14 of LDL cholesterol. The good cholesterol, HDL cholesterol, in the CR was, there was a reduction, that's not good. That was not significant, but tended to be significant. And there was a no significant increase in HDL cholesterol, but it was a trend to from 54 to 56. Okay. Now, in terms of triglyceride, both CR and exercise had a reduction, but it was not significant, but CR and exercise had a major reduction, minus 32 milligram deciliter. So triglyceride went from 121 to 83 milligram deciliter. Fasting glucose was significant in CR, but not in exercise, even if it was close to. And exercise plus CR had significant reduction, 97 to 92. So in some way, all these suggests, the combination of exercise and CR is more powerful. Fasting insulin, again, minus 2.3, minus 1.4, minus 2.4, highly significant. So the data are really, really interesting and supported by other studies. This is a cross-sectional study I did at Washington University on people that have been practicing calorie restriction without malnutrition, with a mean BMI of 19.6, very lean people, very low body fat. These are age and sex matched people who are exercising, running between 50 and 80 kilometers per week. Very lean people, because they're exercising, but they are consuming a typical Western diet as the control group, Western diet, sedentary, that are age and sex matched, but they have a BMI around 27. So as you can see here, both CR and exercise in this long-term CR and exercise study have a much lower total cholesterol, 162, 166 compared to 2002. The bad cholesterol, 88, 92 compared to 122. The HDL cholesterol is increased 63, 61 versus 50. Both have a powerful effect in lowering triglyceride, 58-65 compared to 159 milligram deciliter. But again, confirming that diet calorie restriction is much more powerful in lowering systolic blood pressure, 103/62 versus 125/72, 131/84. And then fasting glucose is very low, 82/90 compared to 95, and fasting insulin 1.42 compared to 66.9. And again, confirming the randomized clinical trial data that calorie restriction is more powerful in lowering inflammation, 0.2 milligram liter compared to 0.8 and 1.1. And again, TNF-alpha, circulating TNF-alpha, a pro-inflammatory cytokine, is much lower in the CR compared to exercise and controls. And again, serum ICAM-1 is an important adhesion molecule. It's much lower in the CR compared to exercise and the sedentary control consuming a Western diet. So there are other randomized clinical trials. I don't have time and I don't want to, bother you with too many data, but apart from these powerful effects, so if I have to summarize again, exercise training in overweight and obese individuals at any age results when it's associated with weight loss in a major improvement in insulin sensitivity, with a significant improvement, more or less, in glucose tolerance and reduction in glucose. It has an effect in lowering definitely LDL cholesterol. In most studies, it has an effect in increased HDL cholesterol. It has an effect in lowering triglycerides, and it has an effect in lowering diastolic blood pressure, but not much on systolic blood pressure, while diet has a powerful effect in lowering systolic blood pressure. And in terms of inflammation, it has an effect, but is not as powerful as diet in lowering systemic inflammation. Now, this is, I think, a very interesting randomized clinical trial where they randomized people with stable coronary disease to percutaneous coronary angioplasty with a stent, with the implantation of a stent, or exercise training. And as you can see here, over 12 months of study, the event-free survival was significantly superior in the exercise training group versus the stent, the angiography with stent implantation group, as you can see here, with a P of 0.23, again, showing that this published in Circulation, showing that exercise not only improves some of the key cardiometabolic risk factors, but it also has an effect that in some ways superior to a percutaneous implantation of a stent without changing then, the lifestyle in the event-free survival. Of course, the best is the combination of, as I've explained, in this review article, is kind of technical. So it's, unless, you are a scientist or a doctor, maybe it's going to be maybe difficult, to understand some of the terminology. But if you want to understand how different nutritional modulations, exercise, and stress reduction can change the cardiometabolic and stiffness and endothelial function and risk of heart problems, you can read this technical review article that I wrote for Nature Reviews Cardiology instead of a less technical writing of my ideas on how different lifestyles are interacting in modulating the factors that are promoting aging and disease of aging. You can read this book, The Path to Longevity. You know, if you want to have some information and my point of view here, there are like 1,400 citations. So each sentence is supported by scientific papers that you can read and make your judgment based on, you know, my statements in my book and in my review article on cardiometabolic health and cardiovascular aging. I just want to remind you, especially if you are new to my YouTube channel, that I created my YouTube channel. You can find it as Professor Dr. Luigi Fontana in YouTube. You can, if you want, you can subscribe so you can have, you can know when I'm posting new videos. I created different playlists with different themes: nutrition, exercise, mindfulness, and there is one on some interesting new studies. Every week I read the literature, and that if I find a paper that I think is important for you, then, you know, I make a small video just to update on some very interesting studies that I think are relevant for promoting human health and environmental health and mental health and spiritual health. And so again, you know, I created different playlists in English and in Italian that people can read. They can watch the videos that are organized. As you can see here, this is Exercise is Medicine. There is a list of videos with different topics that I'm covering, you know, with the hope that people can understand the beauty and the complexity of how what we do, what we eat, what we do physically, mentally, and emotionally, and spiritually has an effect in modulating some of the important metabolic and molecular pathways that are regulating aging and longevity. Thank you for listening, as always.